So next we are going to see about the cognitive function. So as in the beginning only I said, except the cognitive function, everything we are doing it simultaneously because we need certain assessment for the cognitive function. So what is this cognitive function? We are doing it. Okay. First in the cognitive function, consciousness we have to assess that during the general appearance only you are going to assess it. Okay. Then whether they are awake, drowsy, stupor, all that you have to mention it. Then you are seeing about the orientation. Orientation, there are three types of orientations are there. Orientation to place, orientation to time, orientation to person. Okay. Time, place and person. Okay. Three things also you have to assess by asking the question. Okay. You should ask correctly what time it is. Okay. You also should ask who am I? Who are you? Who is standing near to you? That is a person. Place, where are you? That is a place where that. So three questions also you have to ask, then only you will come to know whether the patient is having the orientation. Sometimes they will be having the orientation to time but not orientation to person. Sometimes they have orientation to person but not to the place. That's why it is three questions also have to be asked. Then we are asking about the assessing about the attention and concentration. So attention and concentration is we call it as two sides of one coin. Okay, as you assess the attention, you will come to know the concentration level also. Okay, so attention means you may be asking certain question, like maybe you are asking the telling the numbers backward. Okay, so if they are able to tell slowly like 100, 99, 198 like that, maybe 100 to 90 you can ask them to tell backward. Okay, if they are able to tell properly means that is means they are having the attention what they are telling. Okay, usually sometimes if they are not having it, you have to tell it attention is not present or poor attention. You also can tell attention is elicited difficult. Okay, sometimes they have a attention but with all the difficult, oh they will be thinking 99, 98 like that. Okay, so that is the what difficult way they are having the attention. Then we are having the concentration. Concentration also you can ask same type of questions like telling backward, or you can ask the month. Okay, you can also ask about the concentration, what are the things are kept. Okay, you can let them see and you can tell them to tell that concentration. So you able to whether they are able to concentrate, that you also can do the question. Okay, next we are seeing about the memory. What is memory? Memories are three types. One is we are having the recent memory, immediate memory, recent memory and a remote memory. Immediate memory means what has happened just before. Okay, just before, within the 1 or 2 hours what has happened. Okay, what did you eat in the morning? Just in the morning. Okay, you have come at 10 o'clock and you can ask what did you eat in the morning. Okay, that is immediate memory. What is the recent memory? Within the 24 hours or within the 72 hours what has happened. Okay, that you can ask. Okay, that is means you can ask who came to see you last night, or who came to see you yesterday, who is the doctor who is coming, who came for you for the rounds. So that question can be asked. Okay, that is called as recent memory. Then you can ask question about the remote memory. Remote memories are the past event, more than 6 months, or maybe in that you can ask anything like when did you get married, how many children you are having, then where are they living, all that remote memories can be asked. So usually those who are suffering with Alzheimer dementia patient, this memory will be will not be intact. Okay, they will be suffering, they will not be having the memory impairment will be there. So and also people who are having the mania and depression, their attention and concentration level will be not be intact. Okay, so that is also have to remember. Then we are going to see about the intelligence level. In the intelligence level you can ask some intelligent questions. Who is the Prime Minister of India? Okay, some general questions you can ask. Okay, general knowledge question you can ask. Okay, then you also can ask some arithmetic questions like calculation. Okay, some small calculation don't ask it, you can ask like 24 plus 25 like that you can ask question. Okay, that is some question can be asked related to the intelligence. Then you also can ask about the abstract thinking. What is this abstract? Abstract means something you can imagine. Okay, there is a concrete means something present. Now we are thinking about a ball. Ball is a concrete, you have seen the ball. But if I ask you about the galaxy, it is an abstract, you imagine immediately, you have never seen but you imagine it. Okay, it's a galaxy. So whether the patient is having a concrete and abstract this intelligence is present. How do you ask it? Okay, there is a proverb is one of the way asking. Now you know proverb, when it is said, it has literal meaning is different, but in-depth meaning will be different. Okay, so in their local language there are many proverbs are there. Okay, so there are many proverbs in the local languages are there, that proverbs can be asked, and you can ask, you can elicit the in-depth meaning, whether they are meaning the same thing or something literal meaning they are having it, you can ask it. Also you can find out similarities and dissimilarities. Okay, you can ask with the similarities between the two fruits or two flowers, and dissimilarities between the, what is the dissimilarity between the pen and the this one, what is that, what is it, pen and pencil. Okay, dissimilarities. So that you can ask. So they have to know what is the similarities and dissimilarities. This all comes under the abstract thinking. Also the next one is the judgment. In the cognitive function test, the last one also we call it as judgment. What is the judgment? We are having the judgment, personal judgment, social judgment, and also the judgment in general. So what is the judgment we are having in general? We can ask. Okay, now you can ask certain question related to the personal judgment. What do you want to do? What is your future plans? Okay, whether it is intact. Okay, so my future plan has to be, I want to go home, I want to be with my family. Future plans, okay, fine, it is intact. Okay, judgment is intact. You can ask about social judgment. If any accident happened, what is your reaction? Okay, what you will do? So whether if the patient is sometime more schizophrenia patient will be, what I will do? So judgment is impaired. As normally, if anything has happened, what we will move towards the patient, or we feel pity, or we feel empathetic, that is called as social judgment. So whether it is intact. So you will write whether it is intact or not intact. Then you are going to see about the insight. Okay, the cognition is over. In the cognition, you remember, first you will be doing the consciousness, then you will be doing the orientation, then you will be checking the attention concentration, memory, abstraction, then you will be checking about the this one, judgment, and the last one is, these are the cognition and cognitive function, and the last we are going to see about the insight. So insight is the 7th component of mental status examination. So there are 6 steps, 6 type of insight. What do you mean by, first you should understand what is insight. Insight is understanding that I am sick or able to appreciate what is happening to me. Okay, for example, I have a fever, I am having a cold and cough. I say, oh, I am not keeping well. That is my insight. Okay, so insight is like that. Okay, so mentally ill patient, most of the time they have a poor insight. So if you consider neurotic disorders are anxiety, OCD, these people will be having the insight will be there, but the insight will be not a true emotional insight, but they may have intellectual insight will be present. Whereas you compare to the schizophrenia, mania patient, they may not have a insight at all. They do completely deny that they are sick. That's why they don't take medication. So that's why you have to understand it when you are having the insight. So insight, you are doing it, in that insight you will be finding out what is the type of insight is present. First one is complete denial of being sick. That means they deny that nothing happened to them. That is called as complete denial of illness. That is first. Second one, we are having the insight is present due to the unknown factors, or they something unknown factors. They do not know. Okay, something unknown factors they do not know. That is second factor. Okay, being sick due to unknown factors. Third one is being sick due to the somebody else, because of somebody else. I am sick, it is not because of me. Somebody has brought to me and they have made some supernatural or the superstition belief and all. They have done some mata mantra like that. They will tell, means some type of black magic they have done. That's why I am sick like this. So that is called as external factors. Being this awareness of being sick due to the external physical factors. So first one is denial of being sick. Second one is awareness of being sick due to the unknown factors. Awareness of being sick due to the external factors. Then we are having the awareness of being sick. The person is aware. This one, what is that? Intellectual awareness of being sick. So I already said neurotic disorder any anxiety patient and all or OCD patient, they know that they are sick, but they may not be having the emotional insight, that there is no emotion. Intellectually they are okay, so that they will tell, yes, I'm not keeping well, I don't know what to do, okay, I know I'm having certain problems. So they express it, but the emotion not present. That is called as being awareness of sick or awareness of being sick due to the intellectual insight. Our last one is called as true emotional insight. All the normal human being always will be having true emotional insight. Normal human being means those who are not having any mental illness. We people who don't have mental illness, we have that emotional, whenever any incident happen, any crisis happens, we are emotionally involved, intellectually involved. That is called as emotional awareness of being sick. Okay, so this is all about the insight. Okay, we have discussed about the mental status examination, 7 components: general appearance and behavior, speech, mood, thought, perception, cognitive function, and the last one is insight. 7 components we have studied. So there is mini mental status examination. Remember, mini mental status examination is not the miniature of mental status examination. Mini mental status examination for the people whom we cannot assess the speech, thought or mood, we are doing the mini mental status examination mainly to focus about their cognitive assessment. Okay, so it is done for the mental retarded patient or those who are having Alzheimer, dementia or certain cognitive function you want to assess, then we will do the mini mental status examination. It is not the miniature of the mental status examination. Mental status examination you want means complete mental status examination, you have to assess it. Okay, then we are also having the neurological examination. What is this neurological examination? Cranial nerve assessment. So you already studied in the your this one, what is that, medical surgical nursing, and also fundamental of nursing, what is the cranial nerve assessment. 12 cranial nerves are there, and each cranial nerve, it has its own functions and responsibility, and if it is not working in that proper way, that it's not showing that sign, then we can say that the nerve which is serving that area is affected. That means cranial nerve is affected. When the cranial nerve will be affected, maybe due to the any brain injuries. Okay, is there any? So if there is a brain injury, there can be associated factors can be present. That's what you have to remember in the neurological examination. We also will do the psychological assessment for the depression, for mania, for schizophrenia, then also for the Alzheimer, dementia, neurological problems. So we have a OCD problems, we have a psychological test. It comes as a rating scales and checklist that we will be doing. Also we have to do certain other assessment will be done as a part of the medical assessment, that is called as MRI will be done, CT scan will be done in order to understand the brain imaging, laboratory investigation such as includes a thyroid function test, renal function test. Also other tests will be done based on the condition of the patient. So today we have discussed, or in this video we have discussed about entirely about the assessment that we are doing on the psychiatric patient.